in the news, in committee meetings in the city, and on the road when you're running, right?
Exactly. Seconds count.
That's right.
All right, Mike, we are at the April 7th meeting, and we are on ready to go.
Great. Thanks, Paul. All right. I would like to welcome everybody this morning and call the Wednesday, April 7th, 2021 meeting of the City of Charleston Health and Wellness Advisory Committee to order. Thank everybody for being here, and begin with a moment of silence, please. Thank you. Okay, we have a medium agenda today, and we have a good crowd here. So let's move through it. For those who are on the committee, the first thing is approval of the minutes from March 3rd, 2021. I saw that Paul has distributed them. Do I have a motion on the minutes, please?
I make a motion to approve the minutes.
All right, moved by Ms. Murray. Is there a second?
I'll second.
Thank you. Second. Any discussions, additions, deletions? If not, all in favor? Looks like aye. Any opposed? The ayes have it. All right, next. I see you've got the agenda up there, Paul. All right, next on our agenda is gun violence in the community. MUSC Hospital-Based Violence Intervention Program. Dr. Hink, is Dr. Hink with us?
She just joined in.
Oh, awesome. There she is.
Hi, everyone. Good morning.
How are you? Thank you for joining in. If you need a moment of breather, if not, we're ready for you.
Yeah, nothing like a long night's work and jumping on. So I got everything ready to go. I'm going to share my screen if that's okay.
Great. It's perfect.
Pull this up. Okay, everyone. So thank you for having me back. I know I spoke with everyone in the fall, and I just wanted to come back and provide an update on where we are with the MUSC Violence Intervention and Prevention Program, and talk a little bit about, I think, certainly a growing need in the community and how the city might be able to help in the coming months as we get the program started. And so again, I'm a trauma surgeon and a violence researcher at the Medical University of South Carolina, and I work at the national level with the American College of Surgeons, working on injury prevention and violence prevention work and research. And so I mean, this is constantly a discussion, right? I think as healthcare providers, we see and we treat victims of violence every day. And, you know, quite frankly, I think are tired of waiting for policies to catch up and funding to catch up to really invest in violence prevention. And so what we know is that hospitals and communities can come together to really put forward evidence-based violence intervention programs that identify high-risk individuals and support victims of violence to help break these cycles, right? And so we know the numbers. So Charleston saw doubling of homicides in the last year, and there's been a lot of discussion in the national media about jumps in violent crime and homicides all over the country. But you even look at cities like Chicago, St. Louis, they have 30%, 40%. We had 100% increase. At our trauma center, our firearm injuries, which are overwhelmingly due to assault, were up 30% in 2020. It's now the second leading mechanism of injury for children, which should be very upsetting to us. And now, based on CDC data, firearm injuries, most of which are due to assault, are the leading cause of death for children in the United States. Not motor vehicle collisions, not other unintentional injuries, firearm deaths, mostly due to assault. And we have a significant racial disparity in South Carolina, with Black children being more likely to be shot than white children fivefold. And so far, you know, I think there's been a lot of things that have happened in the year of COVID that we knew as violence researchers would exacerbate the risk of violence, right? So there's been a lot of people increasing their access to firearms, more children at home, perhaps children that have higher risk factors. They're not in school, they don't have protective mechanisms. There's economic uncertainty, distrust in a lot of systems, both political and in the criminal justice and system. And so we thought maybe we would start to see things get better, but so far the trend is certainly not holding up in 2021, and we're still seeing elevated rates of specifically firearm violence and community violence, okay? And so hence what we are doing, because this is what I can control. I can't control policy, even though we have some very strong evidence-based policies that could be implemented that are currently not, both at the federal and the state level, is that we have some ability to support individuals and provide interventions to address underlying risk factors and social determinants of health that have the potential to improve outcomes for patients and their families, and really aim to prevent and reduce violent re-injury, okay? And so just as a reminder, what these programs do is we really identify individuals that come in with a violent injury or with a lot of risk factors for violence. And we've got more research where we can really look at someone's history and say, gosh, this person is significantly, high risk of experiencing a violent injury in the future. Maybe we need to focus on them and provide them support and intervention. And so in the hospital, in the healthcare setting, we're able to really capture someone, right, at a very vulnerable moment, perhaps after they've experienced a gunshot wound or they're coming in a crisis and have these risk factors. And we have intervention specialists that really ask the question, what is it that's putting this person at risk, and what can we help them never experience this violence again? Which also typically helps prevent violence perpetration, because a lot of times they can go in the same setting, right? And so we identify their risk factors: mental illness, substance abuse, exposures to violence in their home, normalization of violence, prior traumas, right? And we identify these risks and identify what resources we have in the healthcare setting and in the community setting to help create an action plan for the patient and his or her family, okay? And there's intensive wraparound and follow-up for months after they leave the hospital. We think a lot about, children and perhaps, child protective services, right? And they have social workers that work for them a period of time. Most of our children who are victims of violence are victims of community violence from similarly aged people, right? But there's not a system in place in the government, right? Or in many nonprofit settings that really focuses these resources for those very high risk individuals and the majority of our patients that actually experience very violent injuries. And so this is what this does, okay? And so what are these services provided, right? And so we've got these individuals that act as advocates and violence interrupters to provide assessment, mentorship, support, case management for these resources. And they go from everything from education, helping the individual get a GED, tutoring, helping them stay in school, coordinating with their school counselors, getting them hooked up to community college programs, maybe providing them with a small scholarship for after school support or a summer program, helping them get employment. Getting employment is one of the most important things that these programs have found to help prevent violent re-injury, because it gives people hope. It helps keep people out of perhaps criminal activity that they're using to support themselves, right? And so employment is very, very important. Helping with conflict resolution, providing mental health services, mentorship, helping people get healthcare access, transitional or stable housing, getting services through the criminal justice system, or if they're involved in the criminal justice system, coordinating with their parole officers to engage them in this program and actually help keeping them out of the criminal justice system in the future. And so it's really whatever service the individual and the family needs to help address their risk factors and promote recovery socially, economically, health-wise, et cetera. And really, I think the key part of this, right, is relationships. A lot of victims of violence, right, aren't treated necessarily in what we would call a trauma-informed way. There's a lot of biases and assumptions made about them. And what we know is that these programs help identify people as worthy. And we know that when people have self-worth, they are more likely to be successful and be hopeful about their future, right? And so what's the evidence about these programs? We know that they reduce violence recidivism. Some programs have demonstrated reductions of 20% down to less than 4%, which is profound, okay? Improved access and utilization to resources, both health and mental health services, education and jobs training. Mental health services and employment tend to be the most important services for keeping people healthy and out of cycles of violence, these programs have found. Better social outcomes, people have better quality of care, and there's cost savings. And so some of the studies have found that for every dollar invested, 4 is saved in healthcare alone. And there's reduction in criminal justice system involvement as well in these programs. So there's a lot of great evidence in the research that really shows that these programs work. There are not many in the Southeast. There are really great examples in the Northeast. There's some in Philadelphia, UCSF in San Francisco, which is really the gold standard, Boston. And a lot of these have been well researched and are, I think, importantly, incredibly well respected and integral in their community. Once they start, the hospitals and the communities say, we can't do without this. Okay. And so this is what's informed our decision and desire to start one here. And so it's really capitalizing on a teachable moment, a vulnerable moment in the healthcare system or in the hospital, and really identifying what we can utilize in the hospital and the community to help support their recovery and break cycles of violence. Okay. And so what we're targeting is to serve anywhere initially from 80 to 100 victims a year. And that's based on our data at our trauma center on the individuals that we most frequently see that are victims of severe community violence. Okay. It tends to be males. We're focusing on ages 13 to 30 because we are seeing younger and younger victims. And we need to intervene early because we frequently see them back. And that is the goal, right? Is to stop those cycles early. We aim to reduce risk factors. And so we assess them at their baseline and then follow them and look for reduction of risk factors, in addition to making sure that they're getting the services that we are setting them up for. We will be tracking violence recidivism and certainly perceived quality of care and some quality of life and mental health measures. And so here's where we are. We have funding for the first year of a combination of South Carolina DHEC money that was given to us for the care of unfunded patients. And just so y'all know, about 60% of our violently injured patients are unfunded. We got about $1,000 per person from DHEC. It's absolutely nothing for the care, but we thought that this was a good investment in putting it towards this. We also have matching funding from MUSC Department of Surgery and the School of Medicine and the Provost Office. We will have a director that we're currently interviewing for, in addition to these client advocates and interventionalists, with a total of 3 that we're aiming for. And next year, we hope to have a mental health trainee from our trauma psychology program. And we have injury prevention coordinators with our trauma center. And so we'll have a nice, robust team that we're currently interviewing for right now. In addition, we're putting together a stakeholder committee because, like I said, this isn't just hospital resources. This is working with the community to make sure that we can get services to the people that we're helping here. And so this is kind of our internal timeline. And so right now we're in sort of the final stages of our interviews, and we'll hopefully be hiring people here in the next few weeks. We have formal training from the Health Alliance for Violence Intervention, which is a national group that supports the training and technical support of violence intervention programs. We're setting up all of our outreach material, platform for data collection, et cetera. And then come May and June, we will have our individuals set up to really start serving our patients in our community by that time. So we're very excited to roll this out this summer. And of course, summer is when we see upticks in violence, like I said. And so, I think here's where the community comes in, right? Because we have to have a lot of allies to lean on to really make sure that we are providing adequate wraparound services for our children and young adults that are involved in this program, right? And so it's a combination of using city and government resources, nonprofits, individuals that might come forward to support both financially and through other means. For instance, a lot of programs actually provide arts therapy and arts outlets for visual arts and performing arts for individuals, which is great in terms of a therapeutic outlet. And so there's a lot of ways that the community has the ability to support victims of violence that's currently not being utilized and thought about in a creative way. And so I think when we think about how the city can help, well, I've talked to the mayor about this before, and I'll continue saying it, right? These programs across the country frequently end up being supported by the cities. It's an investment in public health, an investment in disparities and inequity, prevention, and keeping people out of the criminal justice system. And so this is something that really could be an investment in our future. There's obviously a lot of stakeholder partnerships. I'm working closely with people with Charleston Police Department. They are aware of this program. We've met multiple times. They're very excited and supportive. I've communicated with people in Parks and Recreation about ways that we can get perhaps our youth and at risk in for programmatic support, and we can help provide them too with reduced cost scholarships, et cetera. And I think we have an opportunity to engage local businesses. A lot of our victims of violence are, if they're not teenagers, very often are part of our hospitality industry. I can't tell you how many cooks that I take care of that are victims of violence. Some are robbed and shot on their way home on their bike after they've been working and have cash in their pockets. There's opportunities to provide community level intervention so that employers know that they have a role too in helping support individuals and really recognizing when someone might be at risk. And then alternatively, providing people jobs after they perhaps suffer an injury, especially if they might have a disability after, because this can be profoundly life altering if they then feel like they can't care for themselves and their families. And I think what's very important is a very vocal, visible commitment to nonviolence and firearm safety as a priority for its citizens, its visitors, and the most vulnerable youth in our community. I think that Charleston has an opportunity to probably step up and vocalize this even more. It frequently gets turned into a police-related issue, a criminal justice issue. Well, really, at the heart of it, we have people in our communities being shot and being killed, and their lives are being taken, and children and other people are hearing these bullets being fired. They're seeing people die in their communities. The impact to other individuals is profound, and quite frankly, we can't put a cost to it. But when our people don't feel safe here and people don't feel safe visiting here, that's a problem for all of us, right? And so there's really an opportunity for us to embrace a nonviolent message and say that we're committed as a city to these efforts. And investment now means a higher likelihood of sustainability in the future. And so there are opportunities in the pipeline for federal funding for community violence and hospital-based violence intervention programs right now. We'll have to see how it will work through Congress and the Senate. But there are proposals in the infrastructure and jobs plans to actually support funding for individuals that do specifically violence intervention work. And so if we have programs already up and going, we're more likely to get support in the future. There's also opportunities in the future to potentially get support from things like CMS, reimbursement as a recognition that this is an important aspect of healthcare and public health. So I'm going to stop there. Thank you for listening, and I'll certainly take any questions that y'all might have. And I provided my contact information at the beginning. And so if anyone would ever like to contact me, please feel free to reach out.
Well, thank you very much. That's a lot of information and some things I'm sure that many of us didn't know, and anything that we can do to help. Any questions for Dr. Hink, who has quite the task ahead of her, and I think could use anybody who wants to sign up to help. I think it's
Yes.
I have a comment.
yes, ma'am.
So Dr. Hink, I'm Jennifer Roberts. I'm the executive director of the Charleston Dorchester Mental Health Center. And we'd love to be part of this because we have 6 and soon to be 7 clinicians housed in police departments and the sheriff's department working with victims of crime through a grant that we got, actually 2 different grants. And so it sounds like a perfect match for us to work together and maybe refer people to you.
Yes.
But we do have clinicians and they're working with the victims advocates in each of those locations. And they're at Charleston City Police Department as well. So I will reach out to you, and when you get to a place where you want partners or people as part of your task force, please include us.
I'll be happy to. Nice to meet you. Thank you so much.
Yeah, thank you. This sounds great.
Any other questions for Dr. Hink?
Hello, Dr. Hink. My name is Kenneth Ray. I'm with the Center for Black Health and Equity. I participated in the evaluation of the Beacon project out of New York City.
Mm-hmm.
And the Beacon project is a partnership between the City Council of New York City and the business community to fund after-school programs to extend the day of middle school and high school buildings to serve as community centers, not only for young people, but for adults. That program has gone through numerous evaluations and has shown to be effective in reducing maladaptive behavior in young people. These beacons are in various communities. They're spread out throughout the New York City 5-borough area, and they look at impact on white, Black, Latino, and Asian young people. So consider looking at the data from that project.
Thank you so much. And I agree. I think one of the things that we're very interested in, right, because there's only so much that we can do when we capture people in the healthcare system. And so ideally, we need to also capture people in the school system, right, juvenile justice, in their communities, right? And so I think what we really need are community-based interventionalists and intervention programs that also really aim to prevent rather than waiting for the injury to happen. And we've been in talks with a group called YAP that's very interested, youth advocacy program that has programs in other communities that provide a lot of similar services, and I think would be a very promising partnership in something like that as well. Thank you for pointing that program out to me.
Anything else for Dr. Hink? One question, if you don't mind, Doctor, would you share your presentation with Paul? Just there's great facts and figures in there, especially internally in the city, in drumming up support. I think some of that would be very helpful if we have access to it. That would be greatly appreciated.
Yeah, absolutely. Happy to.
Right.
Thank you all so much. I hope you have a great day.
Well, thank you for joining us this morning. Appreciate it.
Yeah.
Okay, next on our agenda is Beth Johnson and Kenneth Ray, I believe. Am I right about that, Paul? I just lost my, oh, here it is. Yeah, building capacity in Tobacco Nation to promote health equity. Beth and Kenneth, the floor is yours.
All right, well, good morning. I think I'm on the agenda here first. So Kenny, if that's good with you, I'll just kind of give a broad overview and turn it over to our good friend Kenny. Thanks for letting me share a little bit about what's happening with tobacco control and prevention efforts locally and at the state level. And I just want to say, goodness, you guys have a really heavy morning. Gun control and tobacco on the same agenda. That's a deep breath, and pretty hot topics this year at the state house as well. So a little bit about what's happening with tobacco control efforts pertaining specifically to cities and our state as a whole. I'm sure you all are familiar with the youth vaping epidemic that's kind of has an uptick over the past few years as we've seen electronic cigarettes being introduced into the market. And really the electronic cigarettes have been around for quite a while, but they've become more appealing to youth as now they're in flavors like creme brulee and strawberry and bubblegum and cherry and grape. All, of course, which are very attractive to our youth, our children, young adults, kids really as early as 5th graders, middle school kids who can use these tobacco products and be very, very cunning in using these products in classrooms, at schools, and wherever, because they are shaped like a USB drive. So you guys may, just think about your small USB drive just like this. Some of the products are shaped very much like this, and the kids just hold them in their hand and they just take a hit and they pass these products around. So South Carolina has a higher than national average of high school students who are using e-cigarettes, and about 85% of those students say that they use flavored products. So the work that the American Cancer Society, as well as other tobacco control partners, are really trying to do is to focus on local efforts and how we can work together to combat what the youth are doing. There was a federal law that passed that said, the FDA said that you have to take these flavors off the market. Well, that wasn't really, it didn't really apply to all of the tobacco flavored products. It only applied to disposable cartridges. And so flavors are still on the market. In South Carolina, we are not able to enforce the Tobacco 21 law that was passed at the federal level. So we still see in our communities, we still see, youth under 18 purchasing the product, they're purchasing flavors. So it really has been our local communities who are doing the good, solid work of trying to prevent and control youth tobacco. So there's a bill that was introduced in 2019, and then it was introduced again this year in 2021, beginning of our state legislative session, that would remove the power from local communities to work on any type of flavored products, removal of flavored products from your community, and also work on any tobacco retail license at the local level. So interesting fact is that, South Carolina does not have a statewide tobacco retail license like we do, say, alcohol and some other type of business licensing. I could, if I so choose, I could take a pop tent and I could put it up in my yard, and I could sell all the vape products I wanted to sell, and no one could stop me because I don't have to have a license to sell those products, which makes it really, really hard then for us to control, to regulate, to see who's purchasing the product, and to really try to, again, bring down that number of youth who are engaged with tobacco at an early age. So the bill at the state level, it's House Bill 3681. And I'm taking a deep sigh because, goodness, it's flying through fast. It has flown through the judiciary, the House Judiciary Committee, which Chairman Chris Murphy from the Charleston area chairs that committee. It flew through his committee. They had a little bit of debate on it again yesterday, and some amendments added that would potentially help the cities in order to create special zones. The city of Myrtle Beach created a zoning overlay for the boulevard because they saw a lot of head shops, vape shops popping up, and they wanted to continue their efforts in creating a family-friendly atmosphere on the boulevard. And so they passed a zoning overlay limiting the number of vape shops that could be in an area. They are the only city in the state that has taken that action, and there's actually a lawsuit against them with a few of the shops saying you can't really do that. However, it's what they are trying to do to protect their city, to protect their citizens, and to do something about the youth epidemic with vaping. So this bill of the House, it passed yesterday. It should be likely heard on the floor today, and we're expecting a vote on the floor today. I'm expecting it to pass. It would limit your control as a city of Charleston. It would say to you, the city of Charleston, you cannot make any rules or laws pertaining to flavored products or who sells tobacco products in your city. Only the state has that authority. And of course, we know this most commonly as home rule. And so it would remove home rule for this particular issue. And so we are trying our best to fight big tobacco. And if you've ever been down this road before, you know it can be very difficult and very trying. And some of the things that I heard yesterday in committee were, very frankly speaking, just lies. And I just had to shake my head and say, this is not true. This is not correct. I'm not sure where these folks are pulling their data from, but it's not accurate. So that's where we are with the bill 3681. Really, really important this week is that it's crossover week, and it has to cross through the House to get to the Senate. And we are trying our hardest to stop this bill. So what I would encourage you guys to do is to, reach out if you haven't already. And I know that some of you already have, to reach out to Chairman Chris Murphy, to reach out to other members, of the House, your member, and also the Senate, because the Senate has a similar bill. Actually, it's the exact same bill. It's the companion bill in the Senate. Reach out to them and let them know that this is bad for local tobacco control efforts. And let me just, remind everyone, I don't have to remind this group, but, we in South Carolina can go into a restaurant and enjoy a smoke-free environment because of our cities and our towns, not because of the state. We do not have a statewide tobacco smoke-free law. It is our cities, towns, and local communities who have done that good work. And so this, again, just limits, well, it doesn't limit, it removes the city's power to do anything with tobacco issues on flavors and retail licensing. So big giant picture, big overview. Happy to take any questions, and I'm going to turn it to our friend Kenny to expand on the flavors part of this.
Let's turn over to Kenny and then we'll get into questions if that suits everybody. Okay.
Good morning to everyone in Charleston. My name is Kenny Ray. I am the Director of Programs at the Center for Black Health and Equity. There are, and I support everything that Beth has said, and I also support everything that was said by Dr. Hink earlier. There is some data that suggests that criminal activity, there's an association between criminal activity and smoking. And so if you want to address the perceived nature of young people getting into trouble and getting into violent behaviors, you will also find that there's an association to cigarette smoking, marijuana smoking, and illicit drug use. There are federal, state, and local laws, and Beth mentioned a few of them, but there's the FDA was and is responsible and given authority by the Obama administration to regulate tobacco products in this country. And as Beth said, it only regulated some products and some flavors. And so there are still products on the market, there are still flavors on the market, menthol being one of them, that is allowed to be sold. And young people who would gravitate towards grape and strawberry and mango and passion would gravitate towards menthol if those other flavors are eliminated. And so when the tobacco industry says we're not targeting young people, there is evidence that they are targeting young people. And the other evidence that they're targeting young people is that they're fighting at the state level to prevent local municipalities in improving their health outcomes. The other thing about the Obama administration is that there is a provision in the Affordable Care Act that says that local municipalities and state municipalities will conduct health needs assessments, and those health needs assessments would be important for local municipalities and states to determine what are their concerns from health outcome point of view, and what are the evidence-based strategies to address those concerns. And so when those states have conducted those health needs assessments at the state and local level, they have found that tobacco is a leading risk factor for the chronic diseases in their state. And as a result of that, there are evidence-based strategies on how to mitigate the impact of tobacco when you think in terms of chronic diseases in your state. Most municipalities, most state legislatures, most state health departments are aware that the disparate populations that they are finding in their health outcome assessments are decades long populations that have been impacted. So likely the populations that you find that have the highest rates of illness and disease, chronic disease, in 1970 are the same populations here in 2021 that are impacted. And what links them from the 1970s to current day is tobacco use, poor health nutrition, and the lack of physical activity, with tobacco use being the leading risk factor. So we know what works. We know what works. We know what how to reduce the impact of tobacco use when you think in terms of chronic disease and poor health outcomes. But it takes political will. And Beth was speaking to the lack of political will across the country in some cases, but in perhaps in the state of South Carolina, where you would put something in place that would prevent local municipalities from improving their own health outcomes, we questioned that level of thinking. So this is real. Young people will continue to show up in your emergency rooms. Those numbers will continue to increase in your poison control centers. And it's sad when that does happen, because sometimes those addictions will lead to lifelong health problems that could be a cost issue within your state. So we support local decision making, and we support the American Lung, American Cancer, and American Heart Association in their pursuit for social justice in the state of South Carolina.
Kenny, thank you. I couldn't have said it better or agreed with you any more than the summation you just gave, particularly the home rule part of it, which seems to be constantly eroded here in South Carolina at the State House. And the example that of HR, was it 3681, is just another, and the many examples of the State House trying to pull away from us our ability, especially in the health care business and sort of taking care of our community. It's unbelievable. Anyway, with that soliloquy, I'll turn it over to the committee and see if there's any questions for either Beth or Kenny, who've been gracious enough to join us here today.
Mike, I just one question before we start. I did want to introduce Cynthia from Mwanga. I just butchered his last name, but anyway, Cynthia spoke to us about cigarettes, the flavored cigarettes and advertising before. He also is chairing the smoke-free Low Country for us. And I didn't know if Cynthia wanted to jump in real quick.
Great. If you're there, please jump in with any additional comments you might have. See, still muted.
Yeah.
Beth, while we're waiting for him to come on, if he does, on the legislative end at the Senate, I caught my ear that Myrtle Beach has already enacted an overlay, a zoning overlay.
That's
What are the Myrtle Beach legislators doing with that? Are they in support of HR HB 3681? Or are they sort of walking a fine line and supporting their local city council?
Well, it's very interesting because yesterday on House Judiciary Committee, there's several Myrtle Beach legislators who serve on that committee. And they are concerned because of the lawsuits that have been brought against Myrtle Beach, saying that, they cannot create the special overlay district. And in 2019, they voted against preemption, which is what we want. However, we're seeing a change, and we're seeing those same lawmakers that voted against it in 2019 support it this year. And I don't understand why. I'm not really sure what their thinking is on that.
I got a few guesses.
Well, yeah.
As an elected official, I pretty much can tell you why that is.
Yeah, it's tobacco is a big industry in South Carolina, and they have a ton of money, and they spend millions in our state every year. It was really interesting to me, and I'll just say this. Yesterday, it was brought up about the excise, the tobacco excise tax that's generated from the cigarette tax that was passed in 2010 in our state, and how much money that brings in to the state budget. And it is a significant amount, it's in the millions of dollars. However, tobacco healthcare expenditures cost South Carolina $1.9 billion with B, and that number wasn't brought up yesterday. So, the Myrtle Beach legislators are kind of, just very frankly speaking, they're kind of being wishy-washy right now on it.
Well, it seems to me, if there's going to be any progress from your perspective on this, maybe it's the Senate is the place to go, and maybe you get a friend in Luke Rankin up there. I don't know.
Yes, the Senate is, we've said all along, the Senate, they have some different rules than the House, and it just takes one person to object it. And so we are hoping that we can stop this in the Senate. The Senate is known, of course, as the more deliberative body. So we're hoping that we can stop it in the Senate. It's a bad bill, and it leads to a lot of other things. Of course, you guys have dealt with the plastics issue as well. And so it's the same type of plastics, tobacco. There's a few other bills that are popping up, home rule. Actually, I think there's about 7 home rule bills right now that are floating around.
Oh, yeah. Well, thank you for your hard work, and go forward and prosper. I hope you're successful on this. And really, it's bad precedent. Plus, it's just bad policy. We really need to get after the smoking, and the vaping is just bad news. It's crazy.
Yeah. It is. We had a student in North Charleston whose mom is a volunteer for us. She called me a few weeks ago, and she said that her son had been admitted into the hospital at MUSC for some lung issues. Not sure what was going on. They thought it was COVID. It wasn't COVID. Comes to find out, the 18-year-old had been vaping 2 to 3 pods a day, which would be equivalent to 2 to 3, 4 packs of cigarettes a day. And the mom didn't know about it. She just didn't know. And so, here's this young man who's in the hospital with severely damaged lungs, likely to be correlated with his vaping uptake.
Crazy. All right. Any questions around for Beth or Kenny?
Just one last question, Beth. The municipal association has not really come out as a big proponent for this, or
Yeah, so our friends at the Municipal Association, they have been working to try to carve out an opportunity for cities and counties, or cities specifically, to keep the authority to create a special zoning overlay district. And so an amendment was offered yesterday in the full committee that would allow cities some leeway to carve out a special zone that would allow you then the control to prevent so many vape shops from popping up in a specific district, very similar to what Myrtle Beach has done. So that amendment was offered yesterday. It did pass, and the Municipal Association supports that amendment, and they worked with RJ Reynolds, the tobacco lobbyist at the State House, on that amendment. I think today Representative Fry from the Myrtle Beach area is going to offer another amendment on the bill that may carve out some more room for cities and counties. I'm not sure. And I will say that, Paul, even if that happens, it's going to be debated in court, and there's a lot of room there for questions. So it still would not allow any tobacco control partners to support the bill.
It's interesting. As a matter of policy, there's here in the city, we're big on overlay zones and restrictive zoning, and we have limitations on the number of bars in the entertainment district per linear foot on street fronts and all that. So there's precedent out there for cities to manage their own business and do it in a way that's responsible. I just hope the legislature doesn't get in the way of that, because what's next, right? Next is going to be bars everywhere. And I mean, anyway. All right. Any other questions? This is a highly interesting and very topical subject. So thank you very much. And please keep us up to date on how this all goes, short and long term. Great. Thank you. Thank you very much. Okay, Paul, next, we've got the community health wellness updates. Is there anything in particular on that agenda item that I need to be aware of? You're on mute.
Just like to do a quick go around and see who had, because I know Aretha's on here, and hopefully she's been had some good input about what's going on with veteran, the vaccinations. And then at the end, Tracy will help close it all up with just a COVID update for us.
Okay, sounds great. All right, Aretha, are you there?
Did you say Aretha?
We did.
Oh, about our COVID testing, our COVID vaccines.
Or what Feder has been doing lately. Y'all been busy.
So we have been busy. I think we just hit the 25,000 mark. So we've administered about 25,000 vaccines throughout the low country. We have concentrated a lot on the rural communities. And next week we have some events in North Charleston at the Trident Center. And then that's Tuesday. And on Wednesday, we have an event at the Longshoreman Hall. Both of those events, we plan to see about 1,500 individuals. We're going to do a big marketing push for both of those. At the Trident event, we will administer the walk-in vaccines, and then we partner with DHEC. They're going to have appointment vaccines, and that's our appointment for vaccines, and that's our effort to try to reach everyone, individuals who prefer appointments and individuals who prefer to walk in. So that will be a very interesting event. So that's kind of where we are. It's all about vaccines for better.
Great. Thank you.
And then on the 21st, y'all will be back to City Gym, where you hope y'all did 919 vaccines in a 5-hour period back on March the 25th. And I know you're trying to use the Johnson & Johnson, and you're going to be looking for another large crowd. So we're just so thankful to have you as a community partner.
Thank you.
Yeah, thank you very much. Any questions, comments? Okay, Tracy, good morning.
Good morning.
As a quick bit of side business, do you have 5 minutes when we're finished with this meeting, which is going to end promptly at 10 o'clock, to chat with me on a couple of...
I have at 10 o'clock, but if we wrap up here early, I could definitely...
We're going to do that. All right. Take it away.
Sure.
The finish line is between us and you. So here we go.
Okay. I will keep this
between
very, very brief. So kind of at the zip code level, COVID cases seem to be fairly stable. Here are operational indicators. You can see we're really holding the line at least 3 of our 4 indicators are green. We are still kind of in a yellow zone for kind of the trend, just because we have a positive slope in number of cases from 2 weeks ago. So we seem to be holding well on cases at the Charleston city zip code level, which is great. Of course, the impacts of spring break and Easter remain to be seen. Hospitalizations also seem to be stable, which is very good news. I'd love to see those go down, but we aren't seeing that yet. But at least they do seem to be holding stable. I did just want to bring your attention to some updates in our dashboard. So we're reporting on vaccine demographics now, pulling this information directly from DHEC. So thank you to DHEC for providing us with some amazing data. So on this page, you can see and this is by county. So the default is Charleston County, but you can look statewide or by county and see how many people have been vaccinated. And this is just the number of people that have received a first dose. Total COVID cases from testing. And then I put the population in there simply because we're actually tracking kind of the percent immunity through vaccination, as well as percent of natural immunity through positive COVID testing. And then you can see the combination of that in this little gauge board here. And then you can drill down to see percentage-wise by sex, by race, and then down at the bottom, age distribution of vaccines by whatever county you have selected. So just kind of wanted to bring some sunshine to that, and we're happy to hear input on if that's useful to folks and what else we can do to provide useful information to the community. Just one last little point. The city team has been working really hard through the leadership of our emergency management office. The city's partnered with a variety of providers, and we've been, and through those partnerships, we've helped get more than 12,000 doses administered at city facilities since mid-February. So there's really a lot of great work going on, and I'm happy, to be reporting on vaccinations and positive stuff rather than COVID cases, as I've been doing for the past year. So exciting work, and I'm happy to try to answer any questions anyone might have.
Any questions for Tracy? She has been hard at work at this, like she said, for a year. It's been, I'd like to say, a labor of love. It's certainly been informative and very helpful in the community. I have a question for you, Tracy, before I turn over to the committee. Is there somewhere in the dashboard that shows there's a clearinghouse on a list of places that you can go, that someone can go to get the vaccination? It just seems to me it's almost overwhelming. There's so many different options and possibilities. If there's a clearinghouse that people can go to look at that would be great.
Yeah, the best source for that, and we don't have a link on our dashboard, and I can certainly add that, is the Vax Locator through DHEC. Really, the providers are updating that daily, and so you can see immediately where certain locations are taking appointments currently, and that's really the most up-to-date and best source of information to find a vaccine location.
Seems like to me we ought to add that link if people are toggling through the dashboard. It'd be a good link to have.
Nope, that's a great point. I will add that in this morning. Great. Yeah. All right. Questions for Tracy?
Mike, I just want to, while Tracy's talking and Laurie's on, we were so proud of the Recreation Department starting last week with their outreach, and I didn't know if Laurie maybe just want to give us an update of how busy they've been.
Is that Laurie in the bottom left of my screen that says City of Charleston with a
yes,
a mute on it?
That would be me, yes.
Ah, there she is. The
Good
voice
morning,
of
everyone.
recreation and reason. Good morning.
Something like that. Our phones started ringing the minute that that press release came out of our PIO office. Folks from a lot of our underserved communities asking where and how and all those kind of questions. So we've had a big uptick since last Wednesday of folks talking to us at the 7 sites that we've got. And I hope that we're allowing more people to get in and get appointments made, but a lot of information flowing from those places. So it's been a good exchange for us.
Great. Thank you. Yes, sir.
Hey Tracy, this is Joey Current with Healthy Tri-County and Trident United Way. We have been working hard to try to educate and work with various communities around vaccine hesitancy. Are you noticing any disparities in the data that you can see around, any particular groups that are having lower rates or disproportionate rates of uptake?
Yeah, that's a great question. Obviously, our Black communities are not as represented in the data as you would like to see. It is catching up though, and so getting closer, more representative of what the population demographics actually are. So that has been increasing, but ever so slowly. Honestly, kind of the bigger piece is kind of that Hispanic Latin population. They are way under kind of what the population representation is of that group. And DHEC doesn't give us that, but if you actually go to the DHEC website, they actually show that information for the Latin community, Hispanic Latin community, and that's kind of the biggest difference that I see. But male, female, you definitely it's pretty close to representing the current population demographic. So.
Yeah, and Joey, if I could jump in, I was on a meeting yesterday that Aretha and the other hospitals and DHEC were engaged in, and tried to, Renee was on, that specifically was dealing with the Latinx community and how there's a lot of great digital stuff out there and resources, but what we heard last night yesterday was that we need to get more into the grassroots, because those are great finds if you got a computer and access, but you really need to be down talking on a more local level down on and to do it. So I was really encouraged with the team efforts. I mean, we know what Federa's doing in the rural communities and how they're reaching out to them and what their resources, but really that whole team has a great approach, and they're going to start working together to eliminate silos and try doing more partnering where they can they're already doing that, but I think they're going to try to make a bigger effort to figure out how to better communicate in those local areas wherever possible. So that was with the Latin X group. So very, very energetic yesterday.
Good. Seems to me you've got sort of 2 groups out there. You've got those who are vaccine reluctant, and education and grassroots efforts really works. And then you got those who are vaccine obstinate, and I'm just not sure there's much you can do with that group. It's going to be interesting to see in the end what percentage of the population fits that latter category, because I think we'll learn it as we get through trying to get all the vaccines that are out there into people's arms. But there's a large group of vaccine obstinate people out there too. Right. All right. Any other questions for Tracy or for anybody?
I would like to ask Jennifer Roberts. She keeps wanting us to help her with South Carolina Hope, so I'm going to give you a quick shot.
Okay, great. Please.
Yeah, thanks, Paul. So South Carolina Hopes is we got a grant from the CARES Act, and we are serving anyone who has mental health symptoms that are created from COVID or have worsened because of COVID. It helps pay for people's deductibles and copays if they get therapy. It can help people coming out of jail get medications paid for. It's a group effort with DAODAS. So we're referring to DAODAS if people need drug and alcohol treatment or mental health. So if you know anyone who needs us, and obviously it'll help pay for all services for people who don't have insurance, which is a lot of the people that we serve. So if you know anyone out there that needs help and thinks maybe they don't have the money and they can't get the help they need, they can. And South Carolina Hopes is how they can get it. So please share this flyer with people that you know. We're here to help them, and Charleston Center, and so please pass the word.
Will do. Thank you. Okay. Anything else for the greater good from any member of the committee? Just looking around my screen here. Okay, Paul, anything else needs to be added in?
No, we're 4 minutes that you can talk to Tracy offline about.
That's awesome. Well, before we get to there, I just want to make sure that there's nothing else in the group. Paul, when are we going to meet again? When will our next meeting be?
We will meet the first Monday and Wednesday in April. But in the meantime, I know the Health and All Policies group will be pulling together a subcommittee meeting here sometime around that to talk about what our next steps will be. And so they'll hopefully have a report for our meeting, but I know it's going to be somewhere right around that time.
Okay. Sounds great. Well, as always, for those who take time out of your day to participate in the Health and Wellness Committee, thank you. It's greatly appreciated and makes a huge difference in our community. So unless there's anything else for the greater good, we will stand adjourned until we meet again next month. In the meantime, if you need anything, please get with Paul, and we'll make sure we spread the word accordingly. All right, y'all. Thank